Dr. Larimore here with Larimore Chiropractic and Massage. We use different physiotherapy modalities to help treat patients' conditions and to accelerate the healing process for them, and obviously to give them more pain relief as well. We use electrical muscle stimulation, cold laser therapy, hot and cold packs, and ultrasound therapy. Today I'm going to show a couple demonstrations of electrical muscle stimulation and cold laser therapy. So we're going to start with cold laser therapy. A little bit about cold laser therapy. It's been around for 30 years. The FDA has approved it to treat many conditions. Basically, it creates a physiologic effect where it causes a cellular change inside the cell, which accelerates the healing to reduce inflammation and to reduce scar tissue. Today we're going to be showing a demonstration on Lynn's elbow for a condition called tennis elbow or lateral epicondylitis. So basically any inflammation in the body, it could be the elbow, it could be the knee, it could be the back, the neck, any of those areas, as well as others, you can use cold laser to reduce that swelling and accelerate that healing. So the physiologic effects again would include pain relief, increasing drainage and circulation, increasing that cellular activity, which kind of burns the cell out and allows it to produce new cells. And that way we get a much faster recovery for patients. So the cold laser itself is something the patient won't feel at all, thus the term cold laser. There's a little bit of heat produced, but very minimally is there heat produced. The only contraindication is you would not be able to look directly into the cold laser when it's being applied with the naked eye. Otherwise, it's painless, you don't feel anything, and all the treatment is being applied inside the body. It goes about 3 inches deep in depth, and that's where you get that effect. So we're going to go ahead and treat her elbow. So if she had lateral epicondylitis, all the inflammation would be right here on her outside of her elbow. And so we start the machine, and that's the guide light you see. The actual infrared part of the treatment is invisible to our eyes, but you would just hold it on there for a period of usually 2 minutes to up to 8 minutes per application, and it can be moved around or it can be held in a particular localized spot. And so we're treating the elbow here, going through. Do you feel any heat with that, Lynn? Yeah, there's no heat produced, and it's very comfortable for the patient. And so we get great results with sports injuries. We get good results with just accelerating the typical, neck pain, back pain, those types of things. Because this is an adjunct to the adjustment and to some of the other protocol that we use for treating some of these conditions. So we're going through just a 2-minute treatment here on this particular area. Treatment frequency on this, anywhere from 2 visits to 20 visits. So it depends on the severity of the condition and how long the condition's been there. I've had people 1 or 2 treatments and they're like, wow, I feel completely better. I've had some, it takes 2 to 3 weeks and 10 to 20 visits to kind of get the effect that we want. So that's how the laser's applied. You would go through, we'd probably do a total treatment time of 4 to 6 minutes, but today we're just kind of showing a demonstration here of, and we won't be going through the full amount. No pain or any discomfort, correct? Yeah, so it's doing really good. And so that's how the laser's applied. The electrical muscle stimulation is something we use probably the most in our office. It's more superficial, meaning it doesn't get as deep as the laser or the ultrasound, for example. However, it really helps increase circulation, it helps reduce pain, and it helps with muscle spasm. And so most people with musculoskeletal conditions, such as neck pain, back pain, even extremity stuff, are going to be dealing with those types of things. So we're going to show a demonstration on how we apply the electric stim pads. This is not painful because we take it to the patient's tolerance. And so as you'll see in a minute, I'll bring it only to what's comfortable for Lynn here today. So when we're applying the electrical stimulation pads, we apply 4 pads, and they're usually surrounding the area of complaint or that patient's condition or injury. And in this case, we're going to do the neck and the upper traps. And then we're going to apply, they have a hypoallergenic gel on them, so they stick on pretty easily. And we would apply the pads, in this case, treating the neck and shoulder region as such. And then we gradually increase the amount of stimulation that's going to be applied to the tissue to get the effect that we need. So we utilize the electrical stimulation either pre or post adjustment. And we do that to facilitate the healing of the soft tissue, primarily the muscles, also to reduce muscle spasm and to help decrease pain. And so it's not an uncomfortable type therapy. It feels tingly and kind of makes your muscles jump around. However, it's very comfortable to the patient because we bring it to their tolerance. This process really helps hold the adjustment, but also helps expedite the healing process for that particular injury the patient may have.